discuss today the reasons behind dissatisfied patients after refractive surgery, especially refractive surgeries. I'm practicing for the past 10 years in Saudi Arabia, especially in Jeddah. Here, Jeddah with its famous fountain, I'm practicing in Battle Eye Center. Let's discuss the first important items of the bio-behavioral patterns of the patient. First, patient expectation, the psychological profile of the patient, pain threshold, patient-physician communication, and last, patient understanding of the consent. I will discuss the following items, each in a separate way. The patient expectations. As you investigate the patient for the fitness for refractive surgery, you have to investigate the motive behind doing the surgery. From my experience in Saudi Arabia, the reason behind doing LASIK is getting marriage or career-wise, for example, the military exams or special careers like diving in the Red Sea. If we mention that the expectation of the patients are three main zones, we will find that the outer zone, which is the green one, mean the pre is matching with the post-operative expectation, while the yellow zone, which mean that it's not matching but still acceptable for the patient, while the red zone, which is the dangerous zone where the complaints are more here, that means the pre is not matching at all with the post-operative and the patient is never accepting that. In the pre-operative counseling, we try to make the green zone is larger in comparison to the both yellow and red zone. How? First, always under-promise and over-deliver. Never say that I'm 100% or I can guarantee 100% that you can get vision 20/20 after surgery. Supply the patient with ranges. You can say that the rate of enhancement after LASIK is between 2 to 5%. Also mention the rare complications. For example, there is a very small complication, a very rare complication to have infection after LASIK. It's 3 in 1,000. Also, it was found in different management studies that the main method of marketing in refractive surgery is the word of mouth. And you can see here the highest column here, 78% main method of advertisement is recommendations from previous customers. And in another study, they found that each satisfied patient after LASIK can bring 2 to 3 of his friends/relatives, while the unsatisfied patient after LASIK can repel, believe it, 7 to 10 friends. I will do a test for 4 different personalities. I will get a cup of water, half filled, and ask the patient, does this cup filled with water? Take a look on the reaction of each individual. The first lady will say, wow, the glass is half full. The second, the glass is half empty. The third, it's a half full, half empty. What was the question? And you see the number 4, hey, I ordered cheeseburger. So different personalities need different approaches. Try to avoid number 2, 3, and definitely number 4. I will show you my relative contraindication in refractive surgeries. Patients with such weird hairstyle or tattooing are one of the relative contraindications. If a patient came to me and mentioned that I have 3 glasses for distance and neither of them I feel comfortable with the vision with these glasses. If you find a paranoid personality like Zanga Zanga, this is absolutely contraindicated to have refractive with me. I am so confident to do PRK with the pain after it in females in comparison to males. And as you can see, females are more tolerable to severe pain if we see here comparing to males. During the discussion between the patient and physician, you have to be wise and mindful. These are the 4 common questions that patients like to squeeze the patient, the physician. Like, I hear that the LASIK has a temporary effect. Can you guarantee this operation for me, doc? Can I remove the glasses for reading? Shall I reach to 0, not or 100% 66? Put in your mind, these are difficult questions, and you have to answer, yes, there is a very small percentage that you can need, blah, blah, blah. But never say it's 100% because the nature is not 100%. It's a nice study to mention to you that the patients in refractive surgery or any elective surgery choose their physician within the first 15 seconds, believe it or not. Number 5, patient understanding the informed consent. And I like to highlight the word informant because the consent is not a signature. You should describe the procedure for it, describe the particular procedure recommended, why it's LASIK, why it's PRK, what are the risks, what's the benefits, what are the alternatives. This is just an elective procedure and the name of the surgery conducting the physician. Let me show you another tips that make the patients unsatisfied. We are advertising in a bad way. You see here as-saraha, meaning with an open heart. This means some physicians are hiding a lot of information for another patient. We don't have this problem only here, but even in Western. Take a look. If you drink $1 cup of coffee for 2 years, this is equal to the price of LASIK. Or in this advertisement, we guarantee for you to have 20/20, otherwise you can take your money back. Here, special discounts for graduation. Pricing confusion. You can see here 400 dinars in Bahrain, which equal to 6,000 riyals. Here it's 7,000 nearly. Other hospitals can reach to 10,000, and each one of those is mentioning that I have the most recent technology. It's the best worldwide. We have blah blah blah. So the patient get confused and feel anxious because each one of those are big names. The number 8 of dissatisfaction is the residual error of refraction after the surgery, whether low order aberration or high order aberrations. And the difference between the word low order aberration and high is the one who is corrected with glasses is the low, the one not corrected with the high order aberration mean it's not corrected with the glasses. Also, number 9, the nine points or 9 reasons for having dissatisfied patient is the dry eye, whether it is secretory or hydrodynamic. Night vision problems is one of the big issues in the patient post-refractive surgery. Let me mention to you the take-home messages. This is an important formula. Patient satisfaction is equal to the clinical results divided by patient expectation, which means that the patient expectation is reciprocal to the patient satisfaction. So try to push the patient expectation before surgery to have the maximum satisfaction after surgery. Always under promise but over deliver. Repeat on the patient in the preoperative counseling. There is no guarantee that you can reach 20/20 after LASIK. But the question is, if you have a dissatisfied patient, for example, fluctuation of vision or blurring vision after surgery, what shall I do? First of all, please listen to him. Those patients have a pressure inside and they need somebody who understands their problems. So listen carefully, keep the eye-to-eye contact, schedule them more frequent visits in comparison to the regular normal patients. They should feel that you are so concerned, and ask your staff to deal with them as a VIP. Don't, of course, let them stay in the waiting area with the other patient, other guy, they will talk with them and describe for them their complaints and repel more patients for you. We have a problem here in the Middle East, denial. We say, no, you don't have anything to have problem. Never say this to the patient. You have to say, yes, I can understand your complaint. It happens in a very small amount of patients, and this is what we didn't expect. And always show that you are sorry for what happened. Thank you very much for your attention.